And starting today and over the coming days, Canadian Armed Forces members will begin to transition out of remaining long-term care facilities. But I want to be clear. The Canadian Armed Forces will not leave a facility until it is stable. This means we do not need to be replaced. Before leaving these facilities, they will again ensure that conditions are stable and that staff are well equipped to continue to meet their residents' needs. And our members in uniform have been sharing lessons learned and best practices with the Red Cross to help prepare them for their duties in long-term care facilities, helping our most vulnerable. In the coming days, Canadian Armed Forces members have deployed in these long-term care facilities. They will go into a 14-day isolation period so that they will be ready to resume normal duties, such as providing health care to Canadian Armed Forces members, conducting training, and participating in domestic and international operations. But we still will be there to help if there is another crisis. Canadian Armed Forces will continue to maintain a reserve of 10 augmented civilian care shifts, teams of medical and support personnel who will be ready to assist Quebec facilities in case the situation becomes critical again. These teams will be able to respond to any COVID-19 outbreak that civilian staff and provincial health authorities are unable to control on their own. Beyond that, the Canadian Armed Forces will be ready to respond in the event of natural disasters across Canada's, threats to Canada's safety and security, or a second wave of COVID-19 pandemic. And those who served in long-term care facilities, caring for our family members, our friends, and our loved ones deserve our thanks for their help in fighting COVID-19. They have put themselves in difficult situations to look after some of Canada's most vulnerable residents. In many ways, this has not been a standard operation for the Canadian Armed Forces, but this is exactly what the Canadian Armed Forces does. Our members in uniform have put Canadians' needs, health, and well-being ahead of their own. They put service before a self, and every single time they have answered the call. And for that, they have once again earned the respect and admiration of a grateful nation. Merci beaucoup. Well, answer that question. First of all, I just want to make it clear, we're not actually putting a date on the facilities that we're leaving. The 4 facilities will get, I don't have the exact names of the facilities in front of me here. I can get that to you. But our focus is making sure that the facilities have met our criteria and they are stable before we leave. So we're not putting a date on it. So we got, based on our own experience, the military has some idea how long this may take, but we're not putting an actual date on this. We want to make sure that we make it very clear that we will only leave once these facilities are stable. On average, we were looking at, if we went into a facility that was critical, it would take about 19 to 21 days based on the criteria that we have to make it become stable. Whether it's the infection rate, it's the people returning to work, the access to PPE. So all this was a part of it. So on average, it's been about 19 to 21 days or so. But each facility has been different, and I don't have the exact timeline for those facilities. But one thing I can assure you, because of our people, the work that they have done, they have learned and they've used their lessons, passed those on, but more importantly, been able to move very quickly to make those facilities stable, because ultimately making them stable is exactly what our parents and grandparents need at this difficult time.